thing. There is a statistical link. People with gum disease, people with dental disease and bacteria that is there. This is a highly vascular area of the mouth that seeds the blood, and people with significant disease, they are 7 times more likely to have a preterm baby.
To this new episode of the Wonder Tooth podcast. Today we have an amazing speaker and a very good friend of mine. And we are going to discuss a very important topic to everyone, not just women, but really everyone. Dr. Saha, Dr. Anita Saha, welcome to the Wonder Tooth podcast.
Thank you.
Dr. Saha, she is an undergrad at University of Michigan Medical School, Albert Einstein College of Medicine in the Bronx, and she did a residency at the NYU Presbyterian. You did a lot.
What is the actual difference between a regular cleaning and a deep cleaning? And you define that as a procedure. And in what situation would that be indicated anyway, as opposed to a regular cleaning?
This is a great question, because regular cleaning is basically when you come for a dental checkup, we have to check the gums. So we have to check some measurements. And basically we go with the little tiny thing and we check the height or the measurement from the top of the gum to the top of the bone. And usually the proper measurement is 1 or 2 or 3 millimeter. So the tooth, there is a gum here. Remember, it needs to be nice and flush, but there is a tiny little pocket in that area, very small. And this is where things can get stuck.
Oh, right in the center of the tooth. That's where it makes the pocket.
Right. This is called the sulcus right here. So this is the tooth. The gum is here. And that little area where it gets flushed here, it's not completely attached. There is a little pocket. It's called the sulcus. But 1, 2, 3 millimeter is fine. But if the bacteria gets in here and the plaque and the food debris get in here and we don't clean them properly or regularly, like the 6-month checkup and cleaning, then the bacteria is like, oh, I have food, I am having a party. They start to go in and basically produce more acid and enzymes, and then that pocket becomes deeper. This is when we start to get like a 4 or 5 millimeter. And then the gums on the same time starts to become more inflamed, a little bit more bleeding. If you have no bone loss, the gum looks nice and pink, you can get a regular cleaning. If it becomes a deeper pocket, 4 or 5 millimeter, we have bone loss that we can see on the x-rays and we are checking and there is bleeding all over. This is when we need to say this is a gum infection. It's not just a regular cleaning, so a gum infection. So in order to do that, we cannot go and clean this right away. You need to be numb for this. Now, for pregnant ladies, we like to use something without adrenaline. I like to use like a plain anesthetic with no adrenaline in it because we don't want any issues, basically. But that's just me, and I really like to use that. So we just numb them, and we usually try to do one side at a time. So top teeth, bottom teeth in one appointment. And this is the deep cleaning.
I didn't realize that. I've never gotten a deep cleaning. At your office, I've gotten a cleaning, a very nice cleaning, and he's very good because he'll put it's like almost like Ambisol. I don't know what it is, but he numbs it a little bit, so I barely feel anything, which I would tell my patients is perfectly okay to have some sort of topical anesthetic if they need that for a gentle cleaning. And then I do warn them that most pregnant women in any trimester, if you manipulate their gums because of this high progesterone causing some inflammation, they are going to have bleeding. I try to warn them that like they shouldn't be surprised, like when you guys say like sit up and spit or rinse, that they see a lot of blood. It's not a huge blood loss or anything, but I think it's surprising to some people that they see bright red blood during this cleaning because the gums, even some people when they brush their teeth, they see blood. I have some patients who know they're pregnant because they brush their teeth and they start to bleed. They'll say to me, I knew I was pregnant. This always happens with my pregnancies. And the other thing I tell patients is don't skip your cleaning. And then I do have some patients who come in who are like, I need a root canal. I'm not going to get this. And I tell them the following thing. And that's bad because that baby wouldn't have been preterm this gum disease sets this stuff off, and you end up with a preterm baby, a baby potentially in the ICU because it's little. It's completely unnecessary. Sometimes the patients don't tell us that they went to the dentist, they might need this, but when they do, we always say, you have to get this done. The dentist knows how to take care of pregnant women. I also tell them that if the dentist is worried you're pregnant, you may have to find a different dentist that's willing to treat you. Would you agree with that?
Yes, absolutely. I think they need to get more cleanings actually when they are pregnant.
But what if you have a patient who's like, oh, I only want to do what my insurance covers? How would you approach that then?
Does the insurance really tells you what to do, or you're going to have to take care of your health? That's the big one. I would offer, usually in our office, especially if they have a lot of bleeding or something, I would say maybe we should see you not every 6 months, but maybe every 4 months. And you don't have to see me as a dentist, but you can just see the hygienist, and it's going to be a smaller copay, really.
But the insurance will still at least cover a little bit of that.
Yes, but it's very important for them to get you see, here is the thing. A lot of patients, they don't know really what the plan is like, what they cover, what they don't cover. So some plans, they cover 3 cleanings a year, 4 cleanings a year. And some plans, if you have a pre-diabetic, they can cover 4 cleanings a year. But the patients, they don't know. They think, because it goes sometimes under medical. So they will be like, instead of us paying for medical, like, let's try to get, the gums under control. They do understand. Some of the insurance, they do understand that.
And will your office be something that like they would give people a heads up, like, hey, just so you know, you have this coverage, so you can have more?
Yes, we tell them. Sometimes they have 3 cleanings a year, 4 cleanings a year. We let them know, and you'll be like, you're very lucky. Good. You need to come every 3 months or every 4 months.
That's great. That's great.
Absolutely.
And then I have a question for you. I haven't been pregnant in a long time, so I don't remember this for my pregnancies, but so when I have my cleanings, I'll get x-rays done, but no matter how pregnant they are, what do you do when they're pregnant? Is it something you even do?
Yes. So here is the thing. I would not do any dental work, any even elective dental work in the 1st or the 3rd trimester, unless if it's an emergency. The 2nd trimester.
Well, you said elective. Exactly.
Yeah, elective. Yes. The 2nd trimester, we can do, if something is like, if I don't take care of that filling, now it's going to turn into a root canal. Yes, we can take x-rays, but we put like a double shield. So the double shield is basically like the x-ray shield that we put, and it has a collar, so it covers a thyroid, and we put a double of them. And we use digital.
I mean, that's great.
We use digital radiography. It's really, really, really minimal. A full set of x-rays is like as if you flew from the East Coast to the West Coast. It's the same amount of radiation.
Let's say you had someone who's 20 weeks pregnant and she's just getting a regular cleaning. Would she automatically be offered x-rays? Like that, I'm just confused about that. Is that standard?
I would, if she is a patient of records, like we've seen her before, she's been here, and we can offer her like usually like 4 biopsies, not everything, but just a couple of x-rays here or there. If she's okay. If she's not okay, I always tell them, you know what, have the baby and then come back and we'll take x-rays afterwards. I don't want them to, we don't want to.
We any of our patients that request, we have like a form dental letter that you would get, and it does say x-rays with double abdominal shielding is perfectly reasonable. There is going to be no effect on the baby. We really, really, really want everybody's teeth to be taken care of, because the consequence of a preterm delivery is far, far worse. That's good. You guys are equipped. We can send you patients who are pregnant, no problem. I have a random question that doesn't have to do with dental disease, but I have patients in the 1st trimester that are vomiting. They feel sick. The high pregnancy hormones cause them to feel very nauseated, and a lot of them are actually vomiting multiple times a day. And you know that the stomach acid will cause tooth erosion. I have 2 questions. One, what kind of toothpaste do you recommend? Because a lot of people think like the spearmint or mint toothpaste make them gag or make them feel more nauseated. Is there more neutral flavored toothpaste?
Yes, there are some neutral flavored toothpaste apps. Some of them even are without flavor. And some of them are, they have more, they can rebuild the teeth. They have very mild.
Yes, but I would love a list so I can give
Mhm.
my patients, because it's a serious problem. They would
Yeah.
like to brush their teeth twice a day, but they also don't want to puke while they're doing that. And then I haven't recommended this, but what do you think about, like, if someone's vomiting multiple times a day and they're
Mhm.
very concerned that they're eroding the enamel? There's something I've read about, you can gargle baking soda maybe, and it
So
neutralizes the acid.
the baking soda, the problem with baking soda, some people actually they try to brush with baking
Brush
soda.
with it.
It has large fillers. So
Mhm.
the large fillers can actually cause more wear of the enamel.
What about rinsing if you're just gargling?
You can rinse, but I would rinse with a little bit of water right after. I wouldn't really let anything that's not water sits around the teeth for a longer time.
I'm just wondering, I don't recommend it, but I have plenty of people who are like concerned that they're vomiting 4 or 5 times a day, and they not only feel awful, they can't brush their teeth well because the toothpaste is
Y-
making them puke too. I think it's like a huge
So,
problem. Maybe we can do a totally separate podcast on that
you
one if you
know,
want.
I agree. Sometimes actually a toothbrush and water is not
Mhm.
bad. Just the toothbrush. And I used to do that sometimes because I had like morning sickness was bad sometimes. Just toothbrush and water, and just you need to make sure you floss really well until you get through those couple days.
I have a lot more things to say, but I don't know if we're like out of time and we should just do another one about after pregnancy, like menopause stuff. But I
Oh,
mean
I
it's up
have
to you.
one more
Yes, tell
too.
me.
The TMJ,
Oh,
the
this is
pelvic
really important.
tightness.
You
Yeah.
just brought this up. I don't I have a ton of patients. I think they don't even know they're clenching, they're grinding.
Mm-hmm.
The problem is you clench here, you also clench there.
Mm-hmm.
And it causes something called high pelvic floor tone. And so a lot of people with TMJ, if they're able to treat it, that also helps with their whole body that they're clenching.
Mm-hmm.
And it's the dentist that treats it.
Yes.
And is it something that, like, it's injectable medicine? How do you treat it?
So clenching or paroxysm, nocturnal paroxysm, it could be from stress, it could be from sleep apnea, sometimes can cause that.
Oh,
How we treat it is a very good question. Of course, we need to find out what's the cause of this. If it's a sleep apnea, so it's a completely different, like a CPAP, or there is an appliance, the dental appliance that you can wear. If you are clenching because you're just very stressed, you can get a night guard, a custom-made night guard. Some of them are soft, hard, some of them are hard. Some people, they cannot wear anything in their mouth. They're like, we can. So Botox injection is also another
oh yes, masseter Botoxins,
masseter,
right?
and sometimes even in the temporalis here too, but
Oh.
mostly in the masseter, yes.
And if you had a pregnant patient who was coming to you with that, what can you do for them? Because I'm going to tell you, no Botox
No
injection.
Botox, but a night guard,
Hmm. Okay.
definitely. And sometimes if the night guard is too thick for them, I would say, you know what? I just want to protect your teeth. So they can get away with a retainer on the top and a retainer on the bottom. It's much thinner. And
Oh,
it protects their teeth too.
actually, yes. How does that retainer do if you're constantly vomiting?
Well, you still have to take it off and just rinse, and
It's hard to be a
it's
pregnant
hard.
lady.
But the
Yeah.
outcome is beautiful. So it's worth it. Yeah.
Yes. The outcome is taller than us both. So I'll take it. Do you have any other questions for me?
I think this is wonderful. I think let's move to the next episode. We'll see you guys next week.